Namaste and welcome once again to our video blog of Chief Moksha Yoga Gurukul. Last time we talked about the application and implementation of Hatha Yoga and its techniques into several disorders and problems that we face on our physiological plane. So continuing that discussion, in this video also we will talk about another such application that we can do in terms of the yoga asanas or the asanas of Hatha Yoga into a specific problem that majority of people suffer or face today in some or the other form. The problem is called spinal disc herniation, and it manifests as a critical condition of lower back pain and discomfort. The degree in which the problem appears can be varying. The manifestation of pain and discomfort can be in varying degrees from mild to severe. So first of all, we will try to understand that what the problem is and in what or under what circumstances we can use yoga to alleviate the pain and the discomfort. Now, spinal disc herniation is a problem which is associated with our disc, which is there between the spinal vertebrae, and this problem can manifest in different ways. It can be a cracked disc, it can be an inflamed disc, or it can be a bulging disc. Under all the conditions, there is one common symptom, which is pain and inability to move. So it becomes very difficult for the person to carry on day-to-day activities, and the pain interferes in almost each and every movement concerned with our trunk, especially where the lower back is involved. Now, in case of any such herniation in the disc, the first and the foremost recommendation or prescription is complete bed rest. The person, for the first initial hours or the first day or the second day or the third day, should be completely resting and trying to bring down the inflammation which has occurred as a result of the herniation, which can be in any form. When the pain has subsided, then we can plan on going for some rehabilitation techniques or trying to bring down the magnitude of the problem. One thing that I would like to say that with the onset of such problem, the most common consequence which the person can face is the compression of the spinal vertebrae, and due to that compression, the very fine spinal nerves which comes out at each junction can be compressed, or they can be irritated by the fluid which is passing out from the disc. And that's what causes the main problem in this disorder, in this condition. So, what rehabilitation or curing of this problem focus upon removing. Clinically, the treatment of spinal disc herniation involves tractioning the spine or the vertebral column with the help of machines in physiotherapeutic manners. In yoga, we also follow the same principle, the same approach. That means we are trying to pull apart the vertebral columns without using any external force. We use our own strength and the gravity to bring about that traction. Now, in the next section of this video, we will see some asanas which can help to bring such a traction, where the person can gently and gradually allow their spine or their vertebral columns to get decompressed with the help of some asanas. Thank you. Okay, now in this section we will demonstrate you some of the techniques which helps to give traction to our vertebral column. Please remember that these asanas, they are helpful, but again I would say that it would be better if you do them under expert guidance. We are giving you some very simple techniques which you can easily do by yourself, but still it is advisable to use or to take some expert help and assistance when you do these postures. So the first asana that we are going to use, it's called Trikonasana, and it's a very popular and it's a very common asana. In this section or in this approach, we are going to see that how this asana can be used to bring the traction to our vertebral column. Standing on the mat, opening the legs approximately 3.5 feet, turning the right foot out, and the left foot will come slightly to the inside so that this heel and the arch of the left foot are in one straight line. Then you will use a brick and we are going to put it behind the right heel so that you don't have to go all the way down touching the floor. Raising the arms to the sides, take a deep breath in and exhaling, gently move down and resting your right hand onto the brick. Stretch the left arm straight up and hold the position for at least a minute. Now, there are some things that you have to remember here. This foot has to be grounded all the way so that it acts like your root, a very firm root that you have to press into the ground. And on this root, your spine will extend laterally so that you can bring upon an asymmetric work or an asymmetric workout to your back. Now, as you can see, with the help of this arm, we are going to extend the entire spinal column, and that effort will help us to bring about the necessary traction in this part of our spine. Similarly, we will go to the other side, coming up, turn the foot in. Now the left foot will go out, the right foot will come in, and the brick will go on to the other side. Take a deep breath, exhale, slowly go down, and now this becomes the root, and on this root, now we are going to work on the other side of our spinal column, extending it upwards into a traction, using this arm as a pulling agent. Okay, release. On Asana, which is also providing a traction to the spinal column. Open the legs approximately 4 feet apart. Turn the right leg out, the right foot out. Left foot will be grounded. Raising the arms, exhale and start bending the right knee. The brick will be kept just by the side of this foot, and exhaling, the right hand goes and rests on the brick, and this time we will extend this arm fully up. Now you can see this foot here again has to be grounded, and on this fixed ground the whole body will be extended upwards with the help of this arm. So again you will see that it's a very strong traction to the whole spinal column. Coming back out of it, we'll turn to the other side and perform it in the same way to work out on the other arm or the other part of the spine. Exhale, bend the knee, resting the hands on the brick, and extend the arm so as to pull the entire length of the body from this point up to here. Now please remember, you can put weight on the brick, so you don't have to take all the weight on your knee or on your torso, because one thing which is very important to understand, that in
cases of spinal disc herniation or problems with the lower back, our abdominal muscles seems to be like quite weak. So in that case, if you are not able to bear all the weight from this part or maximum weight from this part, then you can transfer the weight onto this hand here, so that it supports the whole process of healing and rehabilitation. Okay, coming out of the posture, you can relax. The next asana is Mukha Svanasana, which is also a very popular asana in the practice. We'll just see a slight variation, which will again be very helpful in tractioning the spinal column. So standing nearby the wall, we'll take the rope and insert it and place the rope just underneath these bones of our pelvis, which are popping in front on top of the pelvic region. The belt will be inserted just under these two bones. Then, opening up the legs approximately 1 feet apart, and very slowly you have to bend forward, going down, taking the weight on the rope. Please remember, you have to shift your weight gradually on the rope, and with the help of that rope, you have to slowly bring your trunk, resting your hands on the floor, and then adjusting your position so that the maximum weight that you are putting is being borne by this rope, which will again act like a hook, which will keep your body being pulled. And on this fixed base, now you are going to allow gravity to pull your trunk in the opposite direction, to pull the entire spinal column in the opposite direction. Please remember, we talked about the use of gravity. This is the use of gravity. Now you will try to put your head down on the floor as much as possible, and your hands will be hooked on the floor, giving you a solid foundation in front. Now, as you can see, the spine is very much aligned, almost perpendicularly to this to the gravity, and on this fixed base of your pelvis, this traction can happen in the long run. Okay, next asana is a variation of Shashanka asana, which is a relaxing pose for the spine traditionally. But here we are going to make some modifications in the asana so that it can work as a tractioning agent for the spine. Sitting in Vajrasana, the knees will be open as wide as the shoulder. And from here, we are going to keep two blocks or two bricks in front of each knee. The possible length can be like 3 to 4 feet away from the knees, depending upon the length of your trunk, how far your trunk and your hands can go. So from here, take a deep breath, inhale, and slowly exhaling, you have to bend forwards, putting your trunk down without, please remember, without hurting your lower back, and bring the hands in front slowly, grabbing the bricks or the blocks. Now what is the modification here? The modification is, when we are in this position, we will lift our buttocks up, coming up on the knees, and then gradually shift the bricks forward and put the trunk down with the chin resting on the floor, and then this portion, the pelvis, will be pushed backwards. Try to push it back towards your feet. Now please remember, this is, the hands or the palms are fixed here, which is going to fix your trunk from the top, and this opposite force or the opposite push to the pelvis will allow this column to go into the opposite direction. So it is yet again very nice and effective traction technique for the same condition. You have to stay in this asana for at least a minute. And in all the other previous asanas, you can stay from 30 seconds to 1 minute to 1.5 minutes, depending upon your own capacity and your condition. Now, after lengthening or extending the spine, we'll focus upon strengthening and relaxing. So, this asana helps in strengthening the muscular structures in the lower back. This is called the Shalabhasana, and to do Shalabhasana, we will lie down on our abdomen and insert both the hands under the groins or the thighs, keeping them straight. Both the legs will be together and the chin will be resting on the floor. Take a deep breath in, and inhaling, you will raise your right leg slowly up from the floor as much as you can, and then hold it there at a point where it stops turning in your hips area. So you don't have to go or turn to the other side, rather you have to just keep your leg fixed at one spot. Keep the whole leg strong, firm, and allow these muscles to take some contraction, which will help them to become stronger. Exhale, put the leg down, holding it for 30 seconds to 60 seconds. Then inhaling, we'll do the same on the opposite leg. Hold it here while breathing normally. If you feel discomfort, then you can also support your thigh with the palm underneath, just to give some relief in the lower back section. And exhaling, you will bring the leg down. This asana in particular helps in strengthening the tissues in the lower back area. Now after that, the last asana of the series will help in relaxing and releasing the strain and the stress, especially from this part. It's called the Sphinx pose. There is no typical Sanskrit name for this asana. For the Sphinx pose, what we do, we bring the hands in front and place them in a way that the elbows comes right under the shoulder, both of them. The palms are open in front, the head is held up, and the legs are open slightly and released. In this posture, release and relax the whole body and breathe deeper in the abdomen so that you can have a nice inflation of the lower back. Try to spend at least 2.5 to 3 minutes in this asana at the end of the sequence in order to release all the strain and all the tension from the muscles in this area, in the lower back section.
So these are some of the asanas from amongst many which can be used therapeutically to get rid of our problems in the lower back, especially with the spinal disc herniation. Please remember that your own discretion, your own intelligence is very important in application. So use these sequences, but at the same time remember our advice, our recommendation to be under a special or under some expert guidance. Yoga, as we have stated earlier, also is a science of well-being, and it has been brought into this world by the realization and the vision of many yogis since ages unknown. It is our responsibility to preserve this valuable tradition and to carry forward all these teachings in the way we have received them from the past. We will meet again in our next video, where we will talk about yet another issue, yet another area where we can apply these techniques of yoga and receive the benefits. Till then, stay happy, stay healthy. Thank you. Hari Om. Namaste.